Hi Ryan, I'm Jeff. I'm a student athletic therapist with the Edmonton Eskimos. Today I understand we're in the more chronic stages of your trochanteric bursitis rehab. So we're going to do some things to help increase your range of motion where you have specifically deficits in mostly internal range of motion. We're going to do some things to increase your core strength and specifically your glute med strength, which is still somewhat weak. We're going to continue with your log for all your daily activities and kind of how you're feeling and your progress along the way in rehab. We're going to keep working on your cardiovascular fitness and doing as much as we can to kind of maintain your endurance when there's not necessarily something you can do for your legs because of your hip. Some of the other things, like I talked about with core stability, is going to be huge so that we can kind of control along your whole kinetic chain. And because of some of your hip stiffness in the morning, we'll see if we can incorporate ice and help reduce some of the pain, maybe some of the swelling around the area, if any is still residual. Does that sound good to you? Perfect. So the first thing I'm going to introduce today is I'm going to introduce core stability to start, because that's one of the most important things to do. So what we're going to do for core stability, we've been working on trying to brace the whole inner unit and incorporating that into more functional activities. So because we've already established core activation and inner unit activation, what we're going to progress to today is just an active straight leg raise with the core activated. So I'm just going to roll up your shirt a little bit just to make sure that you're bracing. So the same thing that we've been talking about before, try to brace your core and inner unit like we talked about. Hold that, and then once you have that contraction, I want you to raise this leg. Good. And slowly bring it back down. Good. And now do the same thing with this leg. Good. And back down. Do you have any stiffness on this hip where you have the bursitis or have the bursitis?
No.
No? That's good. To help with your flexibility, we're going to do an ice massage first. So what I'm going to do is I'm just going to expose the area, and then I'm going to do a 5-minute ice massage just to help reduce any muscle spasm in the area and help reduce any pain. So okay, I'm just going to roll this down a little bit. I'm going to find the greater trochanter. And I'm just going to do an ice massage around the area for 5 minutes. So when that's done, we're going to introduce some stretching that you can kind of incorporate into a home program as well. The first one, this will help with, especially with your range of motion for your internal rotators and help loosen up your piriformis. So the first thing you're going to do is you're going to bend this knee. Bend this knee, and you're going to cross this over. So you're going to reach this way. Now you're going to bend this knee back and rest that on there. You can use your hands, and what you're going to do is either pull back on your thigh or your knee and pull this leg back into a stretch. Do you feel a stretch with that one?
Yeah.
And where do you feel the stretch? Perfect. So what you're going to do is hold the stretch for 30 seconds. You're going to do it for both sides, just so if you have any problems on this side that are the same as that side, it'll prevent any future injury and prevent any morning stiffness in your piriformis, especially in your glutes. So we're going to do 3 sets of this in the morning and bilaterally, and this is going to help decrease your stiffness overall. And I want you doing this every day. And the next one,
So okay.
perfect. Okay. So the next thing another primary thing that we're going to address today is strength. So going back to the core stability, what I want you to do, now that we've established some inner unit strength, I want you to lie on your side.
Okay. Which side? This one?
Yeah, that was good. So now what you're going to do, we're going to incorporate clamshells. So you're almost in the perfect position. You're going to have your knees bent. You're going to consider your ankles, your hips, almost as a hinge. So what you're going to do, keep those hips stacked, keep everything in line, and your hands under your head to neutralize all your spine. Try to maintain your neutral stability. And yeah, perfect. stay stacked like that. What you're gonna do is, like I said, consider this a hinge, and you're gonna raise this knee just far enough to keep those hips stacked. As soon as you feel these hips starting to roll over, you're gonna pull back down. Is that too easy for you? Is that?
No, that's good.
That's good? Perfect. And same thing as before, you're really going to try to contract through your inner core and maintain that pelvic stability in there. And because this is a fairly new core progression, we're just going to start off with 2 sets, and we'll do 10 reps daily. Sound good?
Yeah.
Cool. Have you tried biking at all with your, have you been doing any biking with your cardiovascular fitness? Or has that been painful to do on
No, I've been doing that.
Good. So let's stick with the bike for now. We'll do some interval type training if that's not too demanding on your hips at the moment. So we'll do a 20-minute program. We'll do intervals of 100 seconds at about 40% of your heart rate max. And we'll do 2-minute intervals, 100 seconds at 40% of your heart rate max, and the other 20 seconds at 90% of your heart rate max.
Okay.
I think that's close to what you were doing before, right?
Yeah.
Good. So we'll maintain that 20 minutes daily. The next thing we're going to do is address, so we've addressed the joint above because we've looked at core stability and looking more into the SI and like the abdominals. What another activity I want to do for more proprioception at the hip is just starting with what you're going to do is get a good angle so you can see what we're doing. What we're going to do is almost a type of proprioception exercise where you're going to take one knee and you're going to put the other leg in front, so it's at a 90-degree angle, knees and hips, and it'll be long, neutral through the spine, and yeah, you'll be in line. And what we'll do is we'll put a balance pad just under your back knee, and we'll work on maintaining spinal stability and pelvic stability through the hips and the muscles that surround the hips. So if you want to try to get down on one knee, like I just demonstrated. Perfect. So you're going to have one knee in front. You're going to be straight through your back. We're going to have a balance pad. So in this case, we'll just use a pillow under your back knee. You can use your hips on your hands on your hips for support as needed. This leg's at 90. This knee's at 90 degrees. And you can use your hands on your hips for support if you need it. Is it more challenging? If you put your hands on your side of your head?
Yeah.
Good. Do you feel moderate difficulty with that one? Good. That's going to help restore some joint stability around the hip joint itself. One of the other goals I want to address today, like I said, we'll maintain your goals, short and long-term goals for rehab, because I know this is a fairly thorough process going through the whole rehab stages. To help deal with the pain after these stretches, I want to use ice, so you can help back up on the bed. So we'll keep using ice as necessary if there's any excessive swelling from any of the exercises, including the cardiovascular exercises on the bike. Then you can ice it after for about 15-minute periods. Other than that, what we can do to protect future injury is just preventing excessive range and movement from doing exercises that irritate the trochanteric bursa. So if there's anything you do throughout the course of the day, like maybe it's sleeping on your side, anything like that, where you're directly putting pressure on the bursa, then we're going to try to continue to avoid those activities. So we did proprioception to address the neuromuscular control. What we might do, you're a biathlon, so we're going to try to get something that's a little bit more, an exercise that's a little more specific. So what we might do is a shooting type exercise where you're on you're lying prone. So if you want to flip over to your stomach, almost as if you were shooting the gun. Perfect. So now what I want to add to address more the core stability is I want you to try to activate that inner unit, but I also want you to activate your glute muscles. So they talk about how to maintain your heart rate and how to kind of tense your body through it all. What I want you to try to do in this position is maintain that neutral spine in your back. And if it helps provide core stability, I want you to tighten your glutes in the back too. So just squeeze those together and relax. And squeeze together, maintaining that neutral spine again. Good, and relax. You'll do these for 3 seconds, so 3-second holds. And to start, we'll do 3 sets, but just 5 reps on each side. This is going to help maintain more outer unit core stability as we move into more of the posterior and longitudinal and lateral core system. I feel like this is a good place to rest, kind of where you have enough exercise and you have some stretches for right now. Like I said, you can use ice for 15 minutes at a time on the bursa and around the hip to help reduce any pain. And if you find icing before helps reduce pain and increase flexibility, then feel free to do that as well. Incorporate all these programs and exercises into your home program. So like I talked about with the stretches and more the core stability stuff to do on an everyday basis, and especially maintaining good posture throughout the day. So maintaining spine stability and pelvic stability, especially as much as you can. Do you have any other questions for today?
No.
Perfect. Thanks.